Hello, ladies and gentlemen. Welcome to our new channel. Today we discuss about a new disease. It's a Kawasaki disease. The very first is the introduction of Kawasaki disease. Kawasaki disease or Kawasaki syndrome is a very rare type of vasculitis, meaning blood vessels inflammation. So, student, you must learn about Kawasaki disease. It's inflammation of blood vessels. It may be arteries, it may be veins, it may be vessels or capillaries. So inflamed blood vessels can become weak and stretched out. When that happens, they are at risk of tearing or narrowing. This limits how much blood can get through to nourish tissues and organs. Students, blood is the basic fluid tissue and connective tissue that transfer food and oxygen to the organs and tissues and all the other cells. So, if there is inflammation in the blood vessels, there is no proper treatment of the cells through the oxygen and their nourish food. So, in the Kawasaki disease, when it happens most often in children 6 months to 5 years of age, it means that this is the disease occur mostly in the young ones, in the infants. It affects all of their arteries, but the biggest concern is the coronary arteries. These supplies blood to your heart. Children with affected coronary arteries can have heart issues as a result. With prompt treatment, most children recover in about 2 months. How common is Kawasaki disease? It is the uh, Kawasaki disease is rare, occurring in an estimated 10 to 20 out of 100,000 children younger than age 5 in the United States and Canada. It means that it's also a very rare disease. It is occurring just 10 to 20 persons, infants, in just 100,000 children. In Japan, Korea, and Taiwan, it affects 50 to 250 out of 100,000 children younger than 5. So, Kawasaki disease is the most common cause of acquired heart diseases in children in the United States, Japan, and other developed countries. So, students, it's a Kawasaki disease symptoms and its causes. So, the symptoms and causes, there is a different type of symptoms here. The very first is the fever, lasting for at least 5 days. Second one is the irritability, red or pink eyes without discharge, redness or cracking of your child's lips or tongue. In this diagram, here is the some childrens which are have the age below 5 years. Fever lasting at least 5 days. In the right side, in the right top, irritability. In the left second is the red or pink eyes. In the mid right is the redness or cracking of the lips or tongue. In the third point is the swelling or redness of hands or feet. Peeling of skin, usually beginning around nails. So swelling and redness of your child's hands or feet, peeling of your child's skin, usually beginning around their nails. Rash mostly on your child's trunk, at the chest portion, at the belly portion, but sometimes elsewhere also. In the swollen lymph nodes in your child's neck, upset stomach, belly pain. So in the very last is there is the in the yellow shirt is the belly pain, and in the right side there is the right bottom swollen lymph nodes in the neck. So what causes Kawasaki disease? How there are different causes of the Kawasaki diseases. The causes of Kawasaki disease is unknown still, although more cases happen in late winter and early spring. Researchers are looking into possible Kawasaki disease causes like infectious and environmental factor are genetics. The basic cause is the sometimes is genetics. There is an issue in the genes which is transfer from the our ancestor to the descendant. So the second one is the environmental factor, mean physical factors, and is the some infection diseases. So students, this is about the Kawasaki diseases and their causes and their symptoms. If anybody has any question about these some topics, so you must write your question in the comment section. Our expert team will contact with you as soon possible. So bye, take care, thank you, Hafiz.